Welcome to another episode of the Spotlight by Chamber South. This show is about our members and for our members to get the spotlight. I'm Alexander Noda, your host today with Synovus Bank and also a proud Chamber South board member. And I'm so happy to be here today with Dr. William Presswood. He's a family psychotherapist from Monarch All Health. Good morning, sir. Good to see you. Good to have you here, man. Super excited to have a conversation this morning. And I wanted to give the audience a little bit of context about you and what you've done throughout your professional career. So Dr. William Presswood grew up in Georgia and attended the University of West Georgia, where he earned degrees in psychology and sociology. After moving to Florida in 2005, he began his teaching career in 2006. Now, with over 15 years of experience and multiple advanced degrees in education, Dr. Presswood has worked with a diverse range of students, and he's now training in mental health counseling, focusing on addictions. His goal is to help individuals reaching their full potential through both education and counseling. Wow. You've done a lot.
I have.
Yeah, that's an incredible career.
Thank you.
I'm dying to listen more about it. But I wanted to touch on a very critical point, which is as we get close to going back to, the back to school time, wanted to have a conversation about the best strategies for parent and teacher communication. Why don't you tell me more about that subject?
Well, it's a good topic because I think that is the building block of a child's education, is having that support of both the parent and the teacher. As a mental health professional, one of the things we notice is that oftentimes we get two reports, one from the teacher and one from the parent, and they're different. So it's important for teachers and parents to be on the same page when it comes to goals for their kids and understanding what is needed to move forward to help the child meet their best potential in this classroom environment.
Absolutely. I have two children of my own, and trust me, I face challenges sometimes having communication with the teachers, or maybe just like you said, we see it in one way when they might be seeing it another way. So having that component of communication is definitely crucial. Tell me about what are some of the best strategies for communication.
So it's important to understand that the majority of communication with parent and teacher is usually focused when there's a problem.
Okay.
It's important to kind of do that when there's not a problem, because to build that relationship as a positive thing is really important, because you don't want that adversarial teacher versus parent thing.
Yeah.
It's important to set that tone from the beginning of the year, to introduce yourself to the teacher, and vice versa. The teacher should be introducing themselves to you, and expectations of the classroom and how they want to be supported, because some teachers need more support from parents and some don't require as much. But it's important to have that open line of communication, either through email, through text, whatever benefits parents. Most teachers that I've noticed recently are using things like Class Dojo or these little apps that are out there. There's a few of them out there. Pinwheel, I think it's another one that's out there. But those are good communication tools to kind of keep on the same page. Again, we want to focus on the good things that the kids are doing in the classroom rather than just the problems, because then that really breaks down that relationship between the parent and teacher. And then oftentimes the kid actually pays for it in the end.
Why would you say, and this is going a little bit off topic out of the line of questioning that I had for you, but I think it's relevant. Why would you say that communication becomes so hard for most people?
I think because we live in a society where we're afraid to express what we want in a way this doesn't seem selfish. So I think that we just have to be able to communicate in a way that is being aware of the other person without feeling we're stepping on their toes. When it comes to parents and teachers and students, kids manipulate. I mean, let's be real. Kids manipulate. They're going to go to the place of least resistance. My teacher hates me, or my parents didn't do this. So again, when parents and teachers are on the same page, kids can benefit from the best. And this is an example. If we wait to the last minute till there's a problem, then we're becoming reactionary, not proactive, and we want to be proactive. Absolutely,
especially with schooling and the educational needs of your children.
Absolutely. Yeah.
You mentioned some of them, but what are some good ways for teachers to keep in touch with parents? You mentioned Class Dojo. Are there any other tools available for facilitating this type of communication?
Yeah, with younger kids, they might use a homework folder. They might use a
Okay.
daily progress report. You might even notice that some teachers have a classroom website, Google Classroom. It just depends on how the school kind of does it. Different schools require different things of different teachers. But some teachers are more technology savvy than others. Some good old-fashioned phone call or email is what you need to do. It just all depends on the age of the kid and the need of the child. Because again, when the kid's older, you might not need as much communication with the school. Not to say you don't need any, but you might not need as much, because teenagers can be, you know,
more self-sufficient.
yeah, self-sufficient, but they also can push the boundaries a little bit more than a younger child.
True. Very true.
Yep.
I remember those good old days.
Yeah.
How often, in your opinion, right? How often should teachers talk to parents, and what are some of the best ways to do it?
So I used to do, when I was a classroom teacher, one of the things I would do is I would pick kids on Friday randomly, and I would call home and just tell the parent something positive that the kid did that week, to build that relationship with the parent. Additionally, I would send an email to occasionally like 3 or 4 parents every other week, just to kind of touch base, because it's important to just let them know you're there. Another thing is schools have a lot of events. They have events like sporting events. They have back to school, open house, all those different things. Teachers and students and parents should be a part of those events, because that builds that sense of community that schools really need to thrive, right? And so when parents and teachers are both involved in that, then again, they can see each other in a different context, not as oh, my kid has a problem thing. We want to build that relationship prior to any problems or issues, because again, we don't want to be adversarial. We want to be cooperative.
Yeah, I'm glad that you touched on that topic, because this is actually that in any professional setting, like outside of even the boundaries of a school, is so important, right? Building relationships, because like relationships is pretty much in every aspect of your life. So I'm glad that you touched on that, because you're helping children see that relationships are being built between both them and their teachers, but between the teachers and the parents.
Yes,
right?
absolutely.
So great point. I appreciate that. What advice do you have for teachers giving parents feedback about their child's progress?
One of the biggest things as a teacher that I would do that worked for me is that I would focus on what the child is doing right. Because if we focus on what the child's doing wrong all the time, then it comes across as not constructive. It comes as critical. True. And kids become disengaged from school. This is where my teacher hates me comes in. And we don't want that. We want kids to engage into school, see that, hey, look, yes, you did something maybe not so right, but hey, you're doing this okay, and we can work with this. So being strength-based is really, really important for both teachers and parents. And also to do it like genuinely, not superficially. Make sure that whatever you're saying is genuine and not necessarily just to placate or make the person like feel better. We want to do it honestly.
But that's pretty hard to do. Sometimes it's really hard to do, because like everybody has a different style, especially in the way they communicate. Maybe some people are better at conveying emotion when some other people are not. So what are some of the tools you would say that you would use to convey that message and come across as, listen, I'm telling you this because I care about you and I want you to improve?
Yeah, so that's a really important point. There's a good book by Dr. Amon's called about the 6 types of ADHD. Even though it's about ADHD, it actually works when it comes to communication with parents and teachers. One of the things he mentions is using the I statements, like instead of saying, oh, you're so smart, say, I really appreciate all the help you've been giving me today, or I really appreciate how involved you've been. Like using those I statements kind of like takes it away from that, but also makes the person feel valued. So using that just like you would, like I feel hurt when, or I feel better when, like those I statements really helps build those sense of like wealth and value without putting like a lot of like superficiality on it.
Okay. Very, very interesting. So now let's talk about, feedback. When you're giving feedback to parents from different backgrounds, how does that change the dynamic? Because especially here in Miami, if you think about it, like we got people from all over the world. So like if you have somebody that comes from a culture where feedback is taken as a sometimes even as an insult, because it's like my child is like the trouble child, right? And some other people are more calm and collected and understanding. So how do teachers manage those interactions with different people from different backgrounds?
Well, there's several things you can do. First, if you don't know, you ask, right?
Okay.
The other thing is there's an old saying that even the Soviets love their children.
Yeah.
So like you have to like find something positive about the kid and start with something positive. Just focus on the positive, and then try to find the constructive part. But again, if you don't know, ask, and then if you make a mistake, apologize and learn from it. But it's really important to have that sense of communication, that sense of, I'm here to learn, I'm here to help you. Sometimes when it comes to teaching and students and parents, there's a power dynamic, and you need to like kind of take that out of there and like understand, look, we're here as a collaboration, not as I know more than you. Because as a teacher, you're also a learner, and just like you're a parent, you're also a learner, and as a student, you're a learner. So it has to be many ways. It can't just be one-sided.
Beautiful. I need to get you back into education so you can teach my children.
Yeah.
Listen, now with the rise of AI and all this crazy stuff happening with technology, any new tools or trends that might help improve communication between teachers and parents that you know of?
I mean, I don't think AI is as dangerous as people think it is. I think it can be used for something very positive. I think it can help improve communication. I don't think that we should rely on it completely for everything, but it definitely can give maybe some insight on something we're missing. Maybe we didn't see it from one perspective, and AI can help provide it from another perspective. Yeah. So, I mean, I'm not that versed on it and how it can be applied in education, because I know it's like a no-no right now. But I think in the future we're going to see its value. Is it?
You think it's a no-no now because of people just trying to not do work and just get it done? Okay.
Yeah, I think plagiarism becomes a big deal because I think that AI makes it a little bit easier to kind of get away with not doing your own stuff. So this becomes an issue for schools. I know that schools are really scrambling to keep up with. From what I understand, a lot of them have AI detectors now and all these different things. So I mean, even if you use Grammarly, I think it pops up on AI detectors now. So yeah, like you have to be really mindful of how that works, because schools have a real phobia of AI. I don't know how that is going to be in the future. That's a good question. I don't know how that's going to play out.
So now I wanted, by the way, thank you. That's insightful, because it's like I'm teaching at Miami College now, and it's happening all the time.
Yeah, it's a fear.
Right? It's sure. Like it's full focus on, did they do this work? Did they really do it? So it's a little convoluted. I wanted to give you some time back to talk about any subject that maybe it's interesting to you, anything you wanted to mention. I also want to give you this segment to talk about the work that you're doing at Monarch and anything you want to highlight. The spotlight is on you.
Yeah, well, thank you for that time. I think one of the things I this time of year when people go back to school, it's really a good time if you kind of suspect your child may have a learning issue, that you kind of get that evaluated now before school starts. Like at Monarch, we do ADHD evaluations and assessments. We also look for maybe some other, like maybe learning issues that may be there, may be present, to just enhance and be able to give you the tools as a parent and an educator to make the experience better for children. Because sometimes kids really do have an issue and they don't know how to communicate it. Kids don't have the language to say, oh, I have anxiety today. They say my stomach hurts, or I can't sleep, or my head hurts. They don't say, oh, I'm stressed out. They don't do that. Kids don't know that. They show bad behaviors, or they show something like that we don't always see as, stress or anxiety. So it's important that to have mental health professionals involved to help you kind of give kids that language to help them develop and be able to communicate in an effective way, other than what we see as negative behaviors.
Yeah, and I'm actually really surprised that you brought that up. Some of the stuff you mentioned, like I've gone through an experience with my own kids. So tell me about that. As a parent, what are some of the things you should be looking out for to recognize some of these things that could be confused for misbehavior, and then seek out help? What are like the biggest red flags?
So one of the things that I look for is disorganization. Like, are they messy? Right? You ask them if they're messy. Are they sleeping? Sleeping patterns. It could be things such as, are they getting along with other children? Are they following rules, or do they constantly question, or to the point that it's not necessarily functional anymore? Like they're not getting along with other kids. They're getting kicked out of summer camp, things like this. We want to look for things like that. Other problems can be a little bit more extreme, like bedwetting and stuff like that, but we're not looking for that right now. We're just like basic things like avoiding of homework, avoiding of any kind of tasks that's academic, sometimes acting out so they can get out of it. We call that escape, right? They don't want to read or do math or do anything, so they get in trouble. So they go to the principal's office or they get out. So again, they're avoiding the task avoidance. We were looking for things like that because again, that can be indicative. Maybe there's a reason why they're so anxious about doing that. And it could be like they're crippled by perfectionism and they just don't want to get it wrong. And so this can be something that's also there. Things like that.
Is it something that parents seek out help as a last resort, or is this something that should be given more priority, in your opinion?
So I'm a parent as well. So I think that we don't like to recognize that our kids may have an issue that's beyond our capabilities. Like I have a car too, right? And the car starts breaking. I don't know how to fix it.
Right.
I may have an idea what's wrong with it, but I don't know how to fix it. So I need to take it to somebody who may have a better idea or a different perspective, because maybe I think I'm doing everything correct. I've changed the oil, checked the tires, but the car's not running right. I don't know what to do. Same thing with a parent. They may do everything they think they're doing correctly. In fact, they may think they're disciplining them correctly. They may think they're doing all kinds of things, but the behavior is not changing and they don't know what they're doing. So this is when a mental health professional needs to probably step in and give you some feedback from an objective point to help improve the outcome, because maybe things that worked for your parents are not going to work for you as a parent.
Yeah.
So we have to be mindful of that. And kids are different today than they were 10 years ago. There's a world of technology out there. In fact, in class, I asked my kids the other day, my students, about movies and TV shows, and they looked at me like I was crazy, and they said, we don't watch anything on television.
Yeah.
And I was like taken aback by that, but I was like, what do you watch? And they're like, TikTok and YouTube. So they don't even have any concept of TV or movies like a generation ago would have. So it's interesting to see that change, and that reflects in our parenting styles. Like our parenting has to change if our kids have changed.
Very interesting. That brings me into asking you a question. Historically, I come from a Hispanic household.
Yeah. This
is like stigma. Like you don't talk about mental health. You don't talk about my child's broken. What would you say, if in any way has this changed in the recent period of time? Like, are people seeking out help from mental health professionals in a better light, or is this still like stigma? Let's not talk about it. Let's just avoid it.
Well, this is where schools come in. What I have seen recently is that schools being the intermediary, saying, look, we need services for your child because we're noticing this in the school environment. So parents usually are open to that when they hear the school bringing it in to light, especially if they have like this cultural barrier.
Yeah.
The other thing is, like, as a mental health professional, we don't focus on the diagnosis. We focus on the symptoms, because if you focus on the diagnosis, then people become overwhelmed by it,
right,
and they think it's a label, and they don't want it. My child is not this. My child is not that.
Right.
So we don't focus on the label. We focus on the symptoms, so we can make the behavior better and the functionality better. So schools play a vital role in that, because schools have to be well informed on how to communicate. Hey, look, Johnny is not doing X, Y, and Z in class, and we really need that because he's not going to move forward. So parents are open to that because they want their kids to move forward. They want their kids to be successful. So when you approach it from that angle of progress and success, a lot of immigrant families really latch on to that. But if you tell them, oh, your kid's anxious, oh, no, what's anxiety? We don't know what that is. So I get what you're saying, but again, that's why schools are really important for that, because they become that intermediary.
Good to know that we're heading towards a brighter future.
Yeah.
Tell me more about Monarch and some of the other stuff you guys do.
So it's it's a small practice. We do things like individual therapy. We do evaluations and assessments. I mean, despite as small as it is, we do have a large array of services. So we do, again, individual, family, we do couples, any type of psychotherapy that's out there. But additionally, we have other services like medication management.
Okay.
We also have speech and language pathology that's there, speech and language services. We also do evaluation and assessments, which is very hard to find with people that have like Medicaid or different types of insurances. So we do like ADHD evaluations. We do other types of evaluations, like mental health evaluations and assessments, which are fantastic because, again, not too many people take insurance for that. It's usually like out of pocket, which can be very costly. So we provide that a large array of services. There's EMDR, which we also provide, which is really hot in the therapy world. It's a different approach. Perinatal therapy. We do anything you can think of.
Very cool.
Yeah, we do. We hit a lot of areas.
That's excellent, and it's great to have you in the community. Where are you guys at?
We're in Homestead, but we also provide telehealth services as well. So even if you're not in Homestead, if you're in the state of Florida, we provide services to anybody in the state of Florida. We also provide services to military families that were in Florida and maybe move around a lot. We do have that option as well, but again, they have to be in Florida to start services, and then from there we can branch out.
Perfect. Without mentioning, obviously, any specific details, could you talk to me about maybe a specific outcome that has been a success story for you?
Yeah, I have a client that actually she's being discharged from therapy very soon. She's been doing really, really well. She came in very low self-esteem. She has a physical disability, so that kind of like really ate away at her self-esteem and her ability to kind of go back to school and things. But now she's going back to school. She's feeling independent. She's traveling. She's began to do a whole bunch of things on her own independently without having that sense of like doubt. And that has been really, really good to see that progression in such a short period of time.
That's absolutely amazing. Yeah. Could change somebody's life.
Yeah. Again, just a few months.
Yeah. Incredible. Great work.
Thank you.
I'm going to hit you now with a couple of rapid fire questions as we close out the show. This has been enlightening. I honestly did not know that some of the services were available. My wife is part of the PTA at the school where my children go to, so we'll bring it up.
Okay, perfect.
Just to see if there's any synergies there to exploit. Why not, right? Rapid fire question one, and I think you touched on a couple of them. So anyhow, what's your favorite book on education?
I think Dr. Amen's 6 Types of ADHD is a really good book for anybody who works with children.
Okay, phenomenal. What's one piece of advice you will give to a new teacher?
Before you speak, take a break, because sometimes as a teacher, you as a new teacher, you don't think before you speak, and you can hurt someone's feelings, which I've done in the past. So make sure that you kind of know your audience before you speak.
Have you seen that Inside Out movie?
No, I haven't.
Watch it. It talks about the emotions, especially in children. Okay. And there's like a little red volcano looking like cartoon. And it's anger. It represents anger and goes like, grr, and then his hair lights on fire. So that's, take a minute, breathe, and then have a conversation, right? Yeah. That just came up to my mind. I don't even know why. How do you relax after a busy day at work?
Me personally, I like to watch television if I can, and hang out with I have dogs and cats and birds and all kinds of pets. So I like that. Very cool.
You mentioned too that movie night it's dead, right?
My little kids will watch it, but my older kids look at me like I'm
another
bananas.
World. Yeah. What's the one thing you wish parents knew about teaching?
That it's not easy. I know that people think that the schedule is fantastic. It is fantastic, but it requires a lot. Being a teacher is very difficult because you are with kids all day long, and sometimes you are their secondary parent. And so it is very taxing it's a very hard career. It's a very, very difficult and challenging career, especially now with a lot of limitations put on what can be taught in school and a lot of outside pressure. People who think they know what's best for education, who've never been teachers that are in the classroom, it's really difficult because there's a lot of pressure from the outside on the inside.
Yeah, for sure. Listen, as a proud Chamber South member, and being part of the board of directors, I also wanted to ask you, what does being part of Chamber South community mean to you?
I think when any organization is part of a community, a greater community, it's always great because you can rely on each other's resources. You can begin to collaborate. You can begin to grow in a different direction. In fact, you may be able to connect with people in a way you never thought was possible. And you may go in a direction that you never knew was there. So I think anytime you're part of an organization such as Chamber South, it's a new possibility that's out there, and it betters the community. It's a win-win situation. There's no lose in collaboration.
Absolutely. Well, we'd love to have you. Thank you so
Thank
much
you for
for being
having me.
one of our great members, and thank you for all the work that you're doing out there in the community. I would say to every Chamber South community member and all the members of the South Florida community, check Monarch out. They're doing an incredible job right here in South Florida. And my understanding is, like you said, they could work with you all over Florida, right?
Telehealth, yes.
Perfect. So reach out to them. Thank you so much for being in this episode of Chamber South Spotlight. We'll see you in the next one. Thank you so much, William.
Thank you so much.